Facetite and Elevate postoperative instructions. Speech and smile can be altered for the first few hours after procedure due to numbing agents used. Do not use ice nor heat after surgery. Sleep elevated with a few pillows for the first 5 days after the procedure to minimize your swelling. Avoid aspirin, Aleve, or ibuprofen for 2 weeks after procedure. You may take Tylenol for discomfort or the narcotic pain medication prescribed as needed. Keep your facial garment on for 72 hours, removing only to shower. After 72 hours, you may remove the garment for up to 8 hours, but will need to continue to wear it at home and while sleeping for 3 weeks post-surgery. Not wearing your garment as instructed can affect your result. If Elevate was performed, a neck brace will be provided after the procedure to prevent bending at your neck. Keep the brace on in any instance where your head would be in a declined angle, such as watching TV, looking at your phone, reading, and for the first 10 days. Secure a neck brace every night before sleeping to ensure head is in a neutral position. You may sponge bathe within the first 48 hours and fully shower and wash your hair 2 days after your procedure. Use a gentle cleanser such as CeraVe or Cetaphil and water to face. Drainage from incision sites is normal. It is common to ooze within the first 48 hours. If you experience excessive drainage, please call the Winter Park office. Minimize talking and chewing for 48 hours. Stay well hydrated and eat a soft diet. Baby spoons and straws are encouraged during this time. After 48 hours, you may perform lymphatic massage to jowl area and neck as demonstrated by the nurse. Massage for 5 minutes 3 times per day. It is normal to increase in swelling days 2 to 5 and for the surgical area to feel firm and lumpy. Doing the massage will encourage this to dissipate. If the Elevate procedure was performed in addition to Facetite, you should avoid massaging the neck area until instructed. The surgical areas will be very numb for weeks after surgery and sensation will slowly return with time. Asymmetrical swelling is normal, however, any rapid swelling or swelling that has doubled in size, please call the office at 407-629-5555. Do not smoke for at least 2 weeks after surgery, and avoid places where people smoke. Avoid direct sun exposure and do not use a heat lamp, heating pad, sauna, hot tub, or tanning booth for at least 6 weeks. Shaving should only be performed with an electric razor for the first 7 days. Avoid keeping your chin down for a few months after your surgery, as this can cause increased swelling and delay your results. Remember, although the skin has initially healed, it takes 3 to 6 months before any changes in skin tightening can be perceived, and 12 months before the final result in skin tightening can be appreciated. Refrain from any strenuous activities which may elevate your heart rate and any form of exercise for up to 6 weeks until receiving clearance from our providers. Walking at a strolling pace while avoiding too much heat is acceptable. If you have a fever greater than 101, experience nausea and vomiting, have extreme pain not relieved with your pain medication, or have other concerns regarding your surgery, please call the office. If it is after business hours, the answering service will forward messages to our staff.